Hello everybody, this is Gary. Today is March 15th, 2022. It is 12 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing pretty good. My paranoia is not all that bad. My anxiety levels are pretty low. My depression is not that severe. My paranoia and delusions are much under control. My auditory hallucinations are very low key. I'm scheduled for group therapy today. I'll be leaving in about an hour to go to group therapy. Group therapy lasts for about 2 hours, give or take. I'll be discussing some things that I've experienced over the past week or so with my paranoia and my delusions, my anxiety, my depression, my hallucinations. I just saw my psychiatrist last week. We did not change any of my medications, and we agreed that we would continue my Klonopin and Zyprexa. He suggested that we increase the Zyprexa. I said I don't think that we need to increase the Zyprexa just yet. I have other coping skills that I could use for my paranoia besides just increasing my medication. I'm already on a lot of medications. I'm on 10 medications or more daily. I'm not going to list them all here. A lot of the medications I'm on are for the side effects of other medications that I'm taking. But I'm taking medications for neuromuscular pain, notably Cymbalta, joint pain, arthritis pain, nerve pain. I'm taking medications for acid reflux, medications to keep my stomach from bleeding, pain and inflammation. I take Aleve, I take Tylenol. So I take medications to help me fall asleep at night. I take Seroquel and several other medications that I'm taking. So I'm taking more than 9 or 10 medications daily just to get through the day. I'm not seeing my therapist until the 30th of March. We agreed that I would see her 3 weeks later for my last appointment, which was last week. My paranoia was pretty bad yesterday and a couple of days before that. It's not as bad or intense today. I don't think anyone's spying on me or following me or trying to hurt me in any way. I always have auditory hallucinations though that tell me that people are following me or spying on me, but that doesn't necessarily mean I buy into the voices that I'm hearing. Depends on how loud they are, how intense they are. And when I hear voices, they're not inside my head. I could hear them like they were audibly coming from the outside of my head and my ears, and I hear them audibly. That's part of my schizophrenia symptoms. It's part of the positive symptoms of my schizophrenia. Positive symptoms are symptoms that add to your personality that a person normally wouldn't have, like hearing voices, seeing things that aren't there, paranoia, delusions, that kind of thing. Negative symptoms are symptoms that take away from the personality that a healthy person would have, like motivation to do things, drive, enjoyment of life, hobbies, work, activities, friends, a lack of desire to enjoy those things. Those would be negative symptoms. Antipsychotic medications work better on positive symptoms than they do negative symptoms. So whenever I have something that I have to do, even if it's just something basic like daily chores, I really often have to push myself to do them and get things done, whether it's my laundry, cleaning my apartment, going for walks, exercise, doing my daily physical therapy exercises. I often don't have a lot of motivation to do those things, but I force myself through it. I often have to force myself through my daily schedule just to get everything done. There's a part of me that didn't want to make this video, but I'm making my video because it's part of my schedule, it's part of my structure, and schedule and structure are a good idea when you're dealing with mental health problems. So as far as the physical pain is concerned, my overall physical pain is down since I started physical therapy and since I started Cymbalta, and went back on Neurontin, also known as gabapentin. I'm also taking Tylenol on leave for pain as well, and I'm taking Flexeril for muscle pain. I'm not taking any opioids or anything like that. I'm not taking any controlled substance painkillers. Those would not help. Those would just get me addicted, as they've gotten so many other people addicted in this country. So that's all the report for now.